Welcome to the series Minerals for Whole Health, short lessons on the minerals that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about zinc. Zinc is chemical element number 30 on the periodic table of elements. It bears the chemical symbol Zn for two of the letters in the word, for which the origins are a matter of debate. It is possible it's derived from the German word Zinc, meaning tooth-like, and presumably related to its appearance in its metallic form. Zinc also has an appearance like the metal tin, the German word for which is Zinn, which may also be related to zinc's naming. There's another theory that it derives from the Persian word Zinc, which means stone. Zinc's role in the body is massive and diverse. Researchers have helpfully divided it into three categories. First, dozens of enzymes, that is, proteins in your body that help chemical processes along, are dependent on zinc. In some cases, this is because zinc is an active participant in the enzyme molecule or process being carried out by the molecule. Other times, it's because zinc assisted with the creation of the enzyme in question. That takes us to the structural, where zinc stabilizes some important protein structures during and sometimes after they are folded into their functional shapes. Lastly, in the regulatory sphere, zinc works with DNA for copying it and expressing genes. A zinc deficiency can manifest in several ways, with some, such as loss of appetite, depression, diarrhea, and even hair loss being somewhat non-specific symptoms in nature. The really specific telltale signs of zinc deficiency, though, are loss of taste and sometimes smell, in addition to increased frequency of infections and poor wound healing. Stress and infection speed the use and excretion of zinc from the body, hence risk for zinc deficiency increases with hospitalization and with many medical conditions. Pregnant women are at risk because of their increased needs relative to normal, while vegans and vegetarians face a heightened risk because of diets relatively lower in zinc, which is found in many animal foods. But also, plant-based diets are higher in phytates, a class of plant chemicals which inhibits zinc absorption. And speaking of absorption, those with inflammatory bowel diseases and those who have had a GI surgery, including bariatric procedures, are at an increased risk of zinc deficiency due to their relatively lower nutrient absorption capacity. Lastly, acrodermatitis enteropathica is an inherited genetic condition leading to severe zinc deficiency. Like many minerals, zinc needs vary by population. The RDA for men is 11 milligrams per day, while the RDA, that is a recommended dietary allowance, for women is 8 milligrams per day. During pregnancy, a woman's needs increase to 11 milligrams per day, and during lactation, it goes up even further to 12 milligrams per day. Good sources of zinc include the following: shellfish like oysters, crab, lobster, beef, poultry, pork. Of course, we're talking about a lot of meats here, animal products, but also legumes, nuts and seeds, and whole grains. You will find a healthy dose of zinc. Just remember, again, the phytates in those plant foods do tend to impair zinc absorption, so you may need more if those are your exclusive sources of zinc. The tolerable upper limit for zinc is 40, and some would say 50 milligrams per day. A little bit of debate on which cutoff is most appropriate, but the key issue is above a certain level, again 40 to 50 milligrams per day, you run into the risk of copper deficiency. What happens is excessive zinc prompts your body to produce the protein metallothionein, which blocks the absorption of copper in the intestines, which means, again, lower copper absorption, not as much copper getting into your tissues, hence induced copper deficiency. Importantly, there are no known cases of reaching a zinc toxicity from diet alone, so the risk arises effectively exclusively from supplements or from food contaminated with zinc released from galvanized containers. Signs of acute toxicity include nausea and vomiting, poor appetite, abdominal pain, headaches, and diarrhea. Now, of course, all these are fairly generic symptoms, so talk to your doctor if you have concerns about possible zinc toxicity. Thank you for viewing the zinc installment of Minerals for Whole Health. We'll see you around.